Hello there. Thank you for joining us on Focus on Africa, coming to you from BBC World News. Now, the World Health Organization has passed a resolution at its annual assembly recognising snake bites as a global health priority. Don't touch your TV control yet. The WHO says complications from snake bites remain one of the most neglected tropical diseases. Now, annually, at least 5.5 million people are bitten by snakes around the world. And every year, about 2 million cases of envenoming. Now, envenoming is the disease that you get as a result of being injected by venom. More than 100,000 people who've been bitten will die, and 20,000 of those deaths are in Africa. If you're not killed, 400,000 people globally are left permanently disabled with face blindness, amputations, and a whole range of other disabilities. And that's all because of a snake bite. It in turn puts great pressure on a country's health service. Well, this resolution aims to ensure countries follow a common strategy in dealing with snake attacks. Emmanuel Igunza has this report from northern Ethiopia.
Haile Birhan was lucky to get treatment at this clinic for a snake bite.
So it was here?
He was out grazing his cows in this rural town of Abdurafi, northern Ethiopia, when he was bitten. But it took hours to get any help. Frustrated, he sought traditional healing methods before coming to the clinic. He told me he waited so long for treatment that he thought he would die.
It
was around 9 p.m. when I was returning home from grazing my cows when a snake bit me. It was dark and I didn't have a torch, so I asked my friend to help me. We found the snake and a scorpion and killed them. My friend then came and took me to the clinic with his motorcycle.
This is a stock of anti-venom.
But many others are not so lucky. Doctors tell me that poverty and inadequate health centers means dozens of people risk dying without getting proper treatment. Some come to the clinic too late, while others seek help from traditional healers who do more harm. Now, this is a very remote area, and for many of the patients here, they have traveled for long distance to come and get the services at this health center, because in some of the areas, they simply cannot afford the anti-venom that is being administered there. And so this is a very crucial lifeline. On a busy day, this clinic can receive up to 10 patients. One big headache for health workers, however, is that they currently have only one type of anti-venom for all the different species of snakes. It's too expensive to get more.
Sometimes we have many patients in the hospital because the patient, they prefer to come here because of a treatment for free. So the anti-venom is not available in many of health institutions around here and even the region. And where it is available, it is very expensive. So one vial is around 50 or 60 US dollars. And the patient must take at least 4 vials. This is the minimum dose. For pediatrics, for adults, they all take the same dose. And depending on how severe is the envenomation, we can go up to 6 vials.
As I see no objections, the resolution is approved.
And it is these sorts of problems that the resolution passed by the World Health Assembly seeks to address, improving treatment, prevention and rehabilitation programs by providing cheaper and effective anti-venoms, which remain out of reach for many poor countries, especially in sub-Saharan Africa. Health advocacy groups have praised the adoption of the resolution as a milestone in reducing snakebite deaths and disabilities worldwide. But they warn that implementing the resolution will be difficult if donors fail to adequately fund the WHO's snakebite program. Emmanuel Igunza, BBC News, Abdurafi in northern Ethiopia.
Okay, we're joined now by Tia Cohen. She is founder of the Eswatini Anti-Venom Foundation from Simunya. Thank you for joining us, Tia. Just how much does Africa need this new strategy that the WHO is proposing?
This is a lifeline that has been thrown, and we really appreciate the assistance. Snakebite has been neglected for far too long, and this couldn't have come at a better time.
Tia, you work very closely with snakes, which some people will be astounded by. You know them inside out. What happens to your body when you are bitten by a snake?
Well, depending on the species, you can either die within 40 minutes to an hour, or if you're unlucky, you can be bitten by one of the snakes that have got cytotoxic venom, which will cause tissue destroying, your tissue would basically rot. So that is the cytotoxic venom. So it damages your tissue to such an extent that amputation may be required.
Now, there are some African countries who are unable to make their own anti-venom. Nigeria, for example, has their anti-venom made in South America and the UK. Just how complex is it?
It is. It's a complex procedure, and most African countries don't make their own antivenom. We have to rely on other institutions to make. South Africa does make a very good product, but it is complex. It's not something easy that you can do as a sideline. It is a complex procedure that needs to be followed.
Do you yourself collect venom?
Yes, we do. We do collect venom, which we send for the production of antivenom.
Okay, now I understand that there is nothing like a generic antivenom, is there? Is it specific to a species?
No, not necessarily. You do get polyvalent antivenom, which is basically a cocktail which will neutralize the venom of several species within one vial. And then you also get the monovalent antivenom, which is specific to a species.
I get the impression also that looking at the figures, that those aren't the true figures. Many people say that they're actually underestimating there.
No, that's the tip of the iceberg. It's unfortunate that in Africa, the conditions are such that many people die from snakebite without it being recorded. The traditions are that you will bury your loved one at your own home without it being recorded officially. So yes, very much so, it's under-recorded.
Yeah, and I understand many people in Africa fear snake bites more than they would malaria, for example, and even HIV. Tia Cohen, thank you so much for your time. Thank you.